Hey, healthy runners. It is Monday Night Spark. In tonight's training, we're going to be talking about how you can hit your fall PRs despite having some pain. So what I'm going to really do tonight is share with you my 3-step process that will allow you to hit your fall PRs this race season despite feeling some pain. So I know you have some big goals this race season, whether you're running your first half marathon, whether you're running Hartford, whether you're running your first full marathon, or are you running New York? Are you running Marine Corps? Or are you just looking to improve your times? You want to hit a little PR for your half marathon time. So I know these are important to you. And one of the things you can't do as a runner is meet those goals if you have pain. Pain's going to stop you in your tracks. So I'm Dr. Dwayne Scotty. I'm a physical therapist with Spark Physical Therapy, where we help keep runners on the pavement doing what they love without pain, rest, or multiple trips to the doctors. So I want to know tonight if you are a stubborn runner. So what is a stubborn runner? Stubborn runner is someone who is continuing to run despite feeling some pain, and you're ignoring it. So you're feeling that foot pain. When you get to mile 5, when you get to mile 8, when you get to mile 10, where you're feeling that top of the buttock kind of hamstring pain, when you get into 12 miles, and you're just ignoring it. So you're just choosing to kind of ignore it. You're stubborn. You're just going to continue on your training plan, plow through, hoping, praying that you will be able to get to the finish line without needing to stop. So if you're a stubborn runner, just type it in the comment box right now. I'm a stubborn runner, I'll admit. I know how you feel, guys. I'm out there every morning. This morning, right when I hopped out of bed, first thing, foot hit the floor, boom, felt my foot pain. Been battling some plantar fasciitis foot pain myself for the last couple of months. And so I'm with you there. So I'm taking care of my situation, kind of, not fully, but I'm taking care of it a little bit. So I would consider myself a stubborn runner. So if you're a stubborn runner, just type in stubborn runner into the comment box below. It's a no judgment zone here. And if you guys are hopping on here on the live, thanks for hopping on the live. Just type in live so I know you're here watching the live. And guys, I know a majority of you are going to be watching this on the replay. So just type in replay, be able to give you a shout out. I know that you watched it. Type in hashtag team replay as you start to jump on. So I feel your pains. Like I said, in tonight's training, we're going to be talking about this kind of 3-step process that I actually just kind of came up with these 3 steps today, and the acronym is going to be ASK. So we're going to be talking about number 1 is assessing your situation. So we're going to get into that. The second step that we're going to talk about is seeing someone. So the S is going to be seeing someone who can help you. Last step is going to be K, and that's going to be keep doing what has worked in the past. So we're going to get into detail into each of these as we come on here. So I see Sundar's here on the live, and Sundar says he is a stubborn runner. So no judgment zone, Sundar. I hear you. Marva, nice to see you. Thanks for jumping on here on the live. Emmett, thank you for jumping on here on the live. I appreciate you getting some of this content. So let's get into first step here. So first step, whenever you're having pain, when you're running, we need to stop and assess. So that's the A, right? So we're going to assess the situation. You want to say to yourself, is this pain that I felt before, number 1? Is this pain that has lasted after my runs? Or is this muscle soreness? Or are my muscles being taxed really hard? So are you doing a run that this is new in your training plan? Maybe you're adding in some hill work. Maybe this is your first time doing a 7-miler tempo run. So you're going a longer distance, really pushing your pace. Or maybe it's the first time you're doing some speed work, some interval training on the track, and you're really taxing your muscles. So if you're really taxing your muscles, then it's normal for you to feel some lactic acid buildup. Like, think about that feeling, for those of you that ran races before, that feeling that you're going to have toward the end of the race, right? That lactic acid is going to be building up. Is that normal muscle soreness or muscle fatigue feeling? Or are you feeling pain pulling, maybe in your hamstring area, maybe in your calf, maybe in the bottom of your foot, or in the front of your kneecap? So that's more kind of pain, pathological pain. And then the question is going to be, how long does it last? So does this last where you're just feeling it during your run, but then when you stop running, it goes away? So I would say that'd be a minor issue that's going on if it's not lingering at all. But if your pain is lingering, especially if it's lingering a day or two, or if you're starting to feel some pain with just everyday activities. So you're starting to feel that knee pain when you're going up and down stairs. You're starting to feel that knee pain when you're sitting at your desk all day, when your knee's in a bent position, and then you go to stand up and you're getting pain in the front of your kneecap area. So that is kind of what we call more pathological pain. There's probably something going on here, and you have the beginnings of what we call just a musculoskeletal problem. So a problem with your musculoskeletal system, your muscles, your joints, your ligaments, if you did strain a ligament, but more or less, it is pain that's caused by your tissues in and around your body because you're active, because you're a runner. So you're being active, which is a great thing. But as we know, if we do, there's this fine balance in our body. If we do too much load, so the beauty of our body is that it adapts, right? So that's how we get better as runners. That's how you go from a novice runner to an experienced runner. And you start to see those changes and you start to improve as a runner. You start to improve your times. You become more efficient. And there's usually less injuries associated with that because you became more efficient as a runner. However, as your body's adapting, if you add too much load, so you just change that balance a little bit, and you add too much load for what your tissues can develop or handle, then either your patellar tendon, the tendon on the front of your knee, starts to get inflamed. Your Achilles tendon starts to get inflamed and fight back at you. Your plantar fascia in the bottom of your foot, it's saying like, whoa, that's way too much load for me right now. I'm going to fight back at you. I'm going to send some pain signals to your brain telling you to stop doing what you're doing, right? So that's kind of our body's natural response. So if you're feeling any of those pains that I talked about for a day or two after, then you need to do something about that, because it's typically not going to go away on its own if you continue to do your normal training cycle. If you're continuing to run 4, 5, 6 days a week, some people I know are running 6 days a week, then your body's not going to be able to heal from that. And there's just going to be too much load, and it's not going to be able to handle that. So step number 1, assess the situation. Is this normal soreness, or is this kind of pain that I'm feeling? And determine which of those it is. Because if it is pain that you're feeling, then that leads us to our second step. So guys, thank you for jumping on here on the live. Dawn just jumped on here. Thank you for joining on the live, Dawn. For those of you that didn't see my post earlier today, guys, go check out, if you are local to the Hamden area, Hamden, Cheshire, Wallingford area, then MSA, Multi-Sports Academy, is having an open house all week. I kind of posted about it earlier today, 12 hours ago when I started my day after my workout, and I put out some posts yesterday. They have free classes all week long. If you're looking for guidance, go ahead and check them out. I'm going to be giving a little talk tomorrow night. So if you want to see the live, not the Facebook live, but the in-person live version of doing a kind of small mini talk on kind of 3 gym injuries that don't heal on their own, then stop down. Or if we've connected online and we want to connect in person, then stop down Multi-Sports Academy in Hamden tomorrow, beginning at 6 p.m. Some of the festivities will be going on. They got a ton of free kind of giveaways and gift certificates that you can get, whether it's nutrition consult with Kelly. So Kelly did a live with us 2 weeks ago on nutrition. So maybe you want a consult with Kelly, then head on down to the open house, put in for the raffle so you can get a consult with Kelly. Maybe you want a free personal training session with Dawn, and you've been thinking about, hey, maybe I need some more guidance with some of my fitness goals, then head on down to MSA so you can put in for that raffle. Maybe you want a free assessment with moi, and you're having some running pain that we're going to be talking about today, and you want to get that assessed, head on down to Multi-Sports Academy, put in for the free raffle. So we're giving the talks tomorrow, but all week long, guys, classes are free, open, stop down, ton of kind of freebies and things that I think will help you out as an active adult, even if you are not a runner, or if you are a runner. I think that'd be helpful for you. So Dawn, thanks for jumping on here on the live. So we're getting step number 2. Step number 2 is the S part of ask, and that's going to be see someone who can help. So we've all been there before. I think we all try to help what we can do, but we are limited in what we can do, right? So if like I'm not really that handy in and around the house. So actually this weekend, this is my honey-do list for this weekend. I had to put up a bunch of pictures in our house that we had of my daughter. So the two actually right behind me there, I did put those up. That's pretty much the extent of my home improvement, is being able to hang pictures level. And sometimes I make multiple holes in the wall. It's not perfect the first time, but if I ever needed to fix anything, I'm going to call someone for help, right? I'm going to call my contractor friends, and they're going to actually do the work on my house. I'm not going to try to do that on my house. So I would highly advise you, if you are serious about running and you have some PRs that you want to hit this fall and you're having some pain, is seek out a medical professional who can help you. One that specifically specializes in working with runners. So runners have specific demands and specific needs that are different from the general population. And that is one of the reasons why I kind of went down the road, furthered my education, went to a bunch of coursework on running related injuries and how to help runners and treat runners, and then went through a lot of trial and error of my own as I've kind of became an adult onset runner 8 years ago after my hip surgery. And I had SI joint pain. I had proximal hamstring tendinopathy. I had anterior knee pain, so pain in the front of my kneecap. And I was able to trial a lot of the exercises that I really implemented for myself and helped a lot of the clients that I work with. So I would highly recommend to see, I'm a little bit biased toward a physical therapist, being a physical therapist myself, because we are the movement specialist, and we combine hands-on manual techniques, whether or not we're going to manipulate a joint to improve the mobility, mobilize the joint, do soft tissue techniques such as dry needling, instrument-assisted Graston technique, massage with our hands. So we have a lot of versatility in what we do as far as combining hands-on treatment, but empower you, give you the tools to do these specific exercises that you need to do to get your problem better. But any, honestly, medical professional who specializes work with runners, whether it's a chiropractor, massage therapist, medical doctor, seek out those professionals because they will be able to help you. There are specific demands that you have as a runner, and these conditions, there are simple strategies, honestly, to get them better, depending upon how long the pain's been going on, depending upon the level of tissue irritability. Then some of these strategies will be able to help you out. So that's what I highly recommend. I see this every single day. It is why I do what I do, is because I can help the runners that I help, and I get the text messages, I get the messages, each and every day, how they were able to run 12 miles last week and they had less pain, they didn't have so much hip pain, or their foot is about 80% better from just implementing 2 simple stretches that I gave them on their first visit. So those are the things that someone's going to be able to provide that direction for you that you're not going to be able to get necessarily on your own, just searching Google and trying to find out the best remedies. However, we do have this group. So you guys have been awesome posting questions, giving advice. I think that's certainly helpful and a nice place to start for generalized information. But if your pain is lasting after a couple of days of implementing some strategies that someone recommended for you, then go ahead and seek out some help. So does that make sense to you guys? If that makes sense, just type it in the comment box. Makes sense. Hopefully kind of that gives you a little bit different perspective. So we're really talking about those that just jumped on the live here. Let me know you're here on the live. If you're watching on the replay, type in #TeamReplay. We're talking about how you're going to hit those PRs this fall, despite feeling some discomfort, despite feeling some pain. So as we are here on the live, guys, feel free, if you have any specific questions, I'm happy to answer them here. If you're having some pain, you're struggling with some specific kind of pain point, or you've been battling for a while and you have a question, my time is your time right now. So feel free, ask away. I'd be happy to answer any kind of injury-related questions you have or advice that you've gotten elsewhere as a runner, because I want to be able to kind of help you. This is, like I said, your time. So Linda jumped on here. Rochelle, thank you for jumping on here on the live. Donna's here. Hey, what's up, Donna? How are you? Marva says, makes sense. And Coach Clay jumped on here on the live. Coach Clay, thanks for jumping on here. You did a fantastic job last week, even though I was sideways for the beginning part. But now, hopefully, we have this whole tech thing figured out, and everyone is seeing me right side up, and I'm not sideways. So let's get to the last point. And this one is honestly, I think, for a lot of the runners I see, where I think they really lose it and they kind of fall off the cliff. And this last kind of tip here, this 3-step process is the K, so part of ask. So this is keep. You're going to keep doing what has worked in the past. So many times I will kind of see a runner and I'm seeing them for Achilles pain, foot pain, hamstring pain, right? So the most common culprits here. And they say, you know what, I had this problem last spring and I did X, Y, and Z, or I went to PT somewhere and they gave me a couple exercises and then my pain got better and then I just kept running, right? So they just stopped doing what they were instructed to kind of do. What you need to do is, because a lot of these running related injuries happen for a reason. So there's a contributing factor. There's a root cause to why you're getting pain on the front of your kneecap. Front of the kneecap pain, usually associated with some hip weakness. So maybe your hip muscles aren't turning on, which is changing your mechanics, and your kneecap is rolling in a lot when you're running, and that's causing some irritation of the undersurface of your kneecap as it hits your femur bone. Right? So that's what we call patellofemoral pain syndrome. But it's basically due to weakness in your hip muscles. So you need to turn those hip muscles on so then your tracking is better when you're running. Or your ankle mobility might be limited. Your ankle mobility might be limited. Maybe you feel stiff when you go downstairs in the front of your ankle. It feels like it's pinching. When you're doing squats, it feels like it's pinching. So your ankle mobility is limited. So now you're running some hills. Your ankle doesn't flex. So now there's increased tension and stress on your Achilles tendon. And now your Achilles tendon is not happy with you. Right? So there's a reason for why these things occur. Sometimes they are training errors. If you have a huge jump up, this is like classic, right? If you think about our adolescent athletes, they don't do anything over the summer. I just saw a bunch of these past couple of weeks, and then they get back into their sport. They start practicing every single day for 2, 3, 4 hours a night, and then they get these quick overuse injuries because they've increased their workload so much. They really ramped it up. And now their tissues are fighting back at them. But the majority of us active adults, us runners, there's usually a contributing factor. I shared my story before with you as far as my hip, after my hip surgery, because after a hip arthroscopy, so I had a hip scope where it repaired my labrum in the hip, I had like impingement going on in my hip. It takes honestly like a year for your muscles to actually get back the strength that they need to really start running. I started running 3 months after my surgery, and that was actually the first time I actually became a runner. So I didn't have this like running fitness and my running muscles weren't strengthened, but it took so long for me to build that strength up. I had hamstring issues. I had chronic SI joint pain that kind of kept giving me trouble. And I had my colleagues helping me out and fixing me up. But I knew it was because of that underlying weakness. So you need to get down to the root cause of the problem. And then once you find it, and that's what a good physical therapist can do, is find that root cause. And then you got to keep doing your rehab exercises, become the prehab exercises. Meaning, what does that mean? They prevent you from having to do rehab again and having to go to see, a physical therapist and get back into your rehab cycle. So that's where I see a lot of people fall off. You might not need to do them every single day. So if your therapist told you to do exercise every single day, you're doing some clamshells, you're doing some wall slides, you're doing some single leg squats, you're doing some lunges, whatever the exercises are, right? You don't need to do them every day, but you need to do some type of maintenance program. So I've talked about this in the past. My maintenance program to prevent my hamstring injury from coming back is my Nordic hamstring eccentric exercise. That's like the single best exercise you can be doing. And all of the runners on here, if I've helped you with a hamstring issue, you probably got that exercise. That's going to be the long-term fix. So that is a staple in my workouts each and every week. It's in my Monday workouts. I did it this morning, right? I did my 3 sets of 10, really controlling as I came down to build the strength, the resilience up in my hamstring muscle so it's strong enough to tolerate the demands of running, so I don't get that tendon problem that I had for like, I had it seriously for like a year. Asked my wife, every time we sat, long car rides back to Long Island, I had the worst pain in my butt area. I couldn't even drive, right? So it was really annoying because I would have this pain in my butt and I couldn't drive, because when you sit and put pressure on the area, that hurts a lot too. So that is the important part, is to continue, the rehab exercises become your prehab exercises to prevent the pain from coming back, so you can continue to run, so you can hit your PRs this fall without having pain. So again, guys, if that makes sense, let me know if it makes sense. That's really it. That is the 3-step process that I wanted to talk about today. So kind of a shorter one here. We don't have any special guests on the live today, but again, guys, what we went over, step number 1, assess the situation. Are you having pain due to soreness, or is it true pain? And is that pain lasting more than 2 or 3 days? As well as, are you having that pain with normal everyday activities, not only with running anymore? If that is the case, there's like an algorithm here. Then you go to step number 2. Step number 2 is you need to see someone. See someone who specializes in working with runners. Please, trust me, I've worked in many, many clinics in my career. I've come into contact with many, many healthcare professionals, and you need to see someone who can specialize in your area. Like if you wound up having, God forbid, a stroke, or you had a brain injury and you had a neurologic problem, trust me, you do not want to see me for your rehab, because I'll tell you, I'll be the first one to admit, I will not be able to help you, not even hold a candle to any of my colleagues who specialize in working with neurologic conditions, right? So you want to see someone who can help you with your problem. So go see a specialist, please. So that's step number 2. Step number 3 is rehab doesn't stop when your pain stops. Rehab becomes the prehab. Continue with specific exercises that's going to help keep you healthy so you can run, so your pain doesn't come back. So that's our 3-step process, guys. If you found this information helpful, please hit that like, hit the love button. It will help more people to be able to see this post in their little news feed there. So like I said, we're going live within our group because I love this group so much. You guys ask amazing questions. We were back out there with the heat this week, right? This morning it was hot as all can be for my run at 5 a.m. I was in a tank top, no gloves, no long sleeves, and I was dripping sweat. So we were back to the heat, but I think it should cool down the rest of this week. We're going to get to those nice cool fall temperatures that we all love to run in. So if you have any questions, you have any topics, I want to hear from you. Drop it in the comment box. Let me know what topics you want to hear about. Let me know what injuries you want to hear about. I'll be happy to talk about anything. We could talk injuries. We can get in depth to specific injuries. We could talk specific exercises. There's a lot of different ideas that I have, but I want to hear from you and want to know what you want from this group and what you want me to kind of go on for these longer live training posts that we're going to do every Monday night, 8 p.m. or shortly thereafter, especially if I have a busy day of treating and helping others. By the time I got home and I had like 5 bags, walking in the house, drop them down, and then try to hop on here and get on here to talk to all of you. So thank you all from the bottom of my heart, honestly, for coming on here on the live. And if you're watching this on the replay, just give me a shout out, #Team Replay. I hope everyone has an awesome week. Please stop down Multi-Sports Academy this week. We would love to see you. I would love to meet you in person. And happy running, everyone. Have an awesome week. Until next time. Bye.